Welcome to the Pulse of Practice, Balancing Care and Commerce, the podcast, where we explore the real challenges clinic teams face every day and the practical tools and workflows that solve them. So, picture this scenario for a second.
Oh, all right.
It's a Monday morning, right? The clinic door is just unlocked maybe 10 minutes ago, and the phones are just immediately relentlessly ringing.
Yeah, the classic Monday rush.
Exactly. And you have like two front desk staff stationed up there. They are frantically trying to juggle this growing physical line of walk-in patients, people holding their insurance cards, looking super impatient, while simultaneously managing, I don't know, 3 different hold lines.
And let me guess, that little red voicemail light is just flashing.
Oh, absolutely blinking relentlessly. It's like a hazard signal on the main console.
Yeah, that is just the universal visual of clinic stress right there. It sets a frantic tone for the entire week.
It really does. And that's actually the exact focus of today's deep dive. We're looking at why clinics miss so many patient calls, especially during that brutal 8 to 10 a.m. rush, and what operations leaders and clinic owners can actually do about it today.
Right, and we're pulling from a really rich stack of sources for this. We've got data from AgentsApp, some deep healthcare telecom reports, and these incredible MGMA case studies on Valley View Hospital.
Which is great because we want to give you a shortcut to being well-informed without, the total information overload.
Exactly. We're synthesizing the hard data to show where these bottlenecks form.
Okay, let's unpack this because we've all pictured that Monday morning chaos, but we really need to look at the hard data. I mean, this isn't just an anecdotal feeling of being busy, right?
No, it's a massive systemic operational bottleneck. The data is pretty wild. So an average medical practice gets about 53 calls per physician per day.
Wow, perfect. And that adds up really fast.
It does. And the problem is 38% of all these calls cluster heavily right in the first and last hours of the day. That's your peak window.
So the front desk just gets absolutely slammed all at once.
Exactly. And because the infrastructure isn't built for that sudden spike, on average, 23% of calls go entirely unanswered.
But wait, isn't everyone just using patient portals and booking online now?
You'd think so, right? We assume healthcare will mirror e-commerce, but the telecom data completely contradicts that. Actually, 67% of patients still prefer calling.
Really? Over 2/3.
Yeah, healthcare is deeply personal. People want a human voice when they're anxious. Plus, 41% of calls happen after standard business hours, and weekends make up 23% of the weekly call volume.
Right, because people don't just get sick between 9 and 5. So
Yeah.
the demand is 24/7, but the staffing is stuck in a 9 to 5 paradigm.
Precisely. And here is the most alarming stat about that voicemail problem. When people do hit the voicemail because the staff is overwhelmed, 62% of patients who reach it will not leave a message.
Wow. They just hang up. That makes me think of like a flash flood hitting a tiny storm drain.
That's a perfect way to look at it.
Right. The underground pipes just aren't built to handle the sudden deluge at 8 a.m. So the excess, in this case, the patients, just washes away down the street.
And that silent failure has a massive cost. Since 62% of callers just hang up, there's no record. Where do they go?
Right. What does that actually cost the clinic when they wash away?
The hard numbers are pretty sobering. Each missed call costs the clinic between $125 and $200.
Jeez. Just for one single call.
Yeah. And if it's a new patient call, that value jumps way up to $300 to $500 per call.
Because you're not just losing one consultation, you're losing the lifetime value of that relationship.
Exactly. So when you aggregate all that, the average multi-physician practice loses over $150,000 annually just to missed calls and abandoned hold times.
150 grand. That's practically a whole other provider's salary.
Right. And here's a specific call-out from the telecom reports. 34% of patients abandon calls after just 2 minutes on hold.
2 minutes. I mean, that's barely enough time for the front desk to scan an insurance card.
To a patient in pain or feeling stressed, 2 minutes is an absolute eternity.
Yeah, that brings up the human cost, too. Juggling the phones and the physical walk-ins leads to massive burnout for the front desk team. I read in the sources that this results in a 40% annual turnover rate for front office support staff.
It's a brutal cycle. And replacing those staff members costs another $25,000 to $30,000 each time you have to recruit and train someone new.
Not to mention, you lose all their unwritten tribal knowledge. Like, knowing exactly how Dr. Smith likes his afternoon schedule stacked.
What's fascinating here is that clinics think they are saving money by not upgrading their phone systems, but they are actually bleeding revenue and burning out their best staff.
Yeah, it's a completely false economy. And it's not just about the money or the staff turnover. It directly damages the patient's perception of their medical care.
Oh, absolutely. There's a peer-reviewed finding from the AJMC, which involved over 252,000 patients,
Hmm.
that proves this exact psychological leap.
What did they find?
They found that phone wait time negatively affects a patient's perceived access to care, even when appointment availability is totally fine.
Wait, really? So even if the doctor has wide open availability and can see them today, a 5-minute hold time makes them think the clinic is inaccessible.
Yes. In healthcare, the administrative experience completely taints the clinical one. If the phone is broken, they assume the medicine is broken.
That is so wild. Which brings up the Valley View Hospital case study from the MGMA data, which I love. Some of their clinics realized over 50% of their calls were going straight to voicemail.
Yeah, and primarily clustering right around that brutal 10 a.m. peak window.
Right. And the way they fixed it is amazing.
It really is a masterclass in behavioral change. First, they actually measured the data. You can't fix an invisible problem.
Exactly.
Second, they trained their staff to do something totally counterintuitive. They taught them to kindly ask walk-in patients to hold for a brief moment just to answer the ringing phone.
Which feels like it breaks every ingrained rule of customer service. You'd think the physical person gets priority, but it totally avoids that vicious cycle of phone tag.
Exactly. Just by answering, putting the caller on a 15-second hold, finishing with the walk-in and going back to the phone, Valley View reduced total administrative phone time by 48 hours per month.
That is more than an entire work week of human labor saved.
And they saw a 17% increase in work RVUs or WRVUs just by answering the phones and capturing those referrals.
So what does this all mean? It basically tells us that operations and patient perception are fundamentally linked by the phone line. Awareness and training work miracles.
Yes, but human training does have a hard ceiling. A receptionist can only put so many people on hold before the line out the door is a fire hazard.
Right. So how do modern clinics completely solve this without just hiring a massive, expensive call center? It really comes down to a spectrum of solutions.
Right. You have operational fixes like dedicated phone staff physically separated from the front desk or intelligent phone trees.
Sure, but then you have the tech spectrum. This is where a platform like ClinicMaster comes in. It's a Canadian health and wellness clinic management platform.
Yeah, they handle EMR, scheduling, billing, all built for multi-provider and multi-location practices.
Exactly. And we use tools like this, so it's cool to see how they tackle it seamlessly. Their ClinicMaster VoIP system, which is partnered with Nextgo, is a completely built-in clinic phone system.
And it has smart call routing, which is huge, plus multi-location intelligent routing. So if you have 3 branches, you use unified numbers that route the patient based on location.
That's so clean. But my absolute favorite part is the caller context screen pops. The staff knows exactly who was calling and their history before they even say hello.
It completely de-escalates the tension. The receptionist can just pick up and say, "Hi, Mr. Davis, calling about your knee appointment next Tuesday."
Yeah, it changes the entire temperature of the interaction. And the call analytics dashboards are brilliant for oversight.
Right. Ops leaders get real-time visibility into call volume, peak windows, missed call rates, and staff performance.
So they aren't just flying blind anymore.
Exactly.
But here's where it gets really interesting. The AI virtual receptionist.
Oh, the one powered by Alomia? Yeah.
It's a 247 safety net that handles overflow during the day and takes over completely after hours.
And it doesn't just take a passive message. Because it's integrated, it can actively book appointments directly into the ClinicMaster EMR.
Wait, it can actually create new patient files dynamically during the call?
Yes, it sure can. And it performs intelligent triage. It smartly routes truly urgent calls directly to the on-call staff's mobile, so it knows the difference between a routine reschedule and a real severe medical issue.
That is incredible. If you're a clinic owner, this stops the $150 care revenue leak.
Yeah.
You capture that 62% of patients who used to hang up.
It plugs the hole completely.
And for your front desk team, this means they can finally breathe and focus on the patient standing right in front of them.
Because they know the AI is catching the overflow. It's the perfect blend of tech supporting human connection.
So we've gone from Monday morning chaos to this streamlined tech-assisted future. Now, what is the immediate next step?
You need a baseline. You can't fix what you haven't measured.
Exactly. This week, pull your call data for the last 30 days. Look at your peak window, your miss rate, and where voicemails pile up. That's your starting point.
And as you review those numbers, Think about the irreplaceable tribal knowledge that walks out the door when a burned out receptionist quits. Could implementing an AI overflow system actually be your most effective employee retention strategy rather than just a patient acquisition tool?
Wow, protecting the team to protect the practice. I love that reframe. If you want to see exactly how this works in real life, definitely book a demo at clinicmaster.com or download their KPI guide to get started.
It's well worth a look to build a smarter dame for that flash flood.
Absolutely. Thanks for listening to The Pulse of Practice, Balancing Care and Commerce. See you next time.